Yeah, Serena, rock star. You guys are the rock stars. You know, the first time I learned about 2035, which was a couple of years ago, actually, we were with you in the offices at Westminster Council, and it was such an inspiring afternoon. And we got to meet your team and get a sense of the work and the fact that you've continued on this journey, and that you will continue towards 2035. It's pretty admirable, and I'll be keeping a close eye on how things are evolving with you guys. Everyone involved in this is a rock star. So thanks for having me. And I know that my colleague Bram, who was here last week, I think also had a lot of fun. So thank you. And look, I see some people on the call who we've been together at one point or another. So you may hear some things that you've heard before. It's a chance to have a conversation. So I'll try to make some of it interactive by using the chat simply. So no issue in terms of not sharing your cameras if you prefer. But this is in essence, and if you allow me, Serena and Priscilla, I'll get a little philosophical too as we reflect, and then we can kind of have a quick conversation towards the end. But I think there's something around impact that is very clear from hashtag 2035, and around what some have called collective effervescence, the opportunity to partner with communities to build a better social climate. And I think beyond just having the life expectancy differential between the wealthiest and the poorest communities across Westminster, there's something around the social climate that you're seeking to create that I think is really important, and I really admire that. So my suggestions are connected to your aspiration for sure. And I'll tell you, to me, everything starts with purpose and the coherence that one is able to create individually and in teams and in organizations around what we're really trying to achieve. And I think, for me as a starting point, I'll share briefly. My purpose is to reduce suffering and to enhance well-being in community with people like you. So this is bang on the epicenter of my purpose. But it's just important to have a sense of what we are about as teams and as organizations. So if you haven't reflected on your own purpose, whoever's on the call, I think it's always a really fun reflection, and it doesn't need to be fixed for life or set in stone, but it's important to be clear about what we are about, and have a way to make sense out of what we choose to do or not do. When I said I was going to get a little philosophical, I just want to share this story from Honduras, and it's a very quick one, just to reflect on our current times. This is a bridge in Choluteca, and it was built in 1938, and in 1996 it was done up. It was renewed or kind of rebuilt by an American-Japanese consortium, and it was rebuilt because it had been built for about 60 years, and in 1998, there was a hurricane that came through Choluteca and a few regions of Honduras that devastated much of the built infrastructure. As you can imagine, the bridge had just been rebuilt to stand the test of strong winds, and it didn't break down, but the river moved. And the analogy here is an interesting point in time that we're in today, where we have populations that are living a lot longer, technology that is serving good purposes in terms of our ability to understand data and have proximity to people, but also the kind of challenges of social media and the impact on mental health and so on. A set of expectations from the public and the community that is very different to what it was even 15 years ago. So I think the work of 2035 and the teams that are involved with this in partnership with communities is to build the bridge to a river that has moved. And we can take whatever we want from the current climate of the world. There are wars going around very close to us. Here in the UK, we're having elections very soon in England. There is an economic climate that's challenging perhaps, and for some, like Moises Naim, who I happen to know relatively well, he framed some of our current challenges in 3Ps: post-truth, so this idea of truth being kind of anything that anybody frames, really, populism, and polarization. And if you look at what Hans Rosling put together, it was a write-up of optimism. Why are we feeling so badly if we have achieved so much over the last 50 years in terms of social advances, reduction in poverty, improvements in health, and so on? So, whatever side of the fence you sit in, it is a time of change and transition, and I think we have to leverage that opportunity to continue to together build a better world. I was recently in this place, which is Cuba, in September last year, and I was visiting with a group of senior fellows on health equity, and I met Fernando in this farm called Finca Marta. So Fernando has a lovely TED Talk if you ever want to access it, and we spent a little bit of time together trying to understand how he built not just the farm, but the network of farms that he's built. This is Fernando. And he told me two things during our chat that day that really stuck with me. One is, look, he told me I was an academic in the Netherlands teaching sophisticated agriculture concepts. And I woke up one day and I thought, I need to dream by doing. And he packed up his bags and he left. And he went back to Cuba, which is where he was born. And he set out to build a network of organic farms in Cuba. And the other thing that he told me was that agriculture should not be seen as a business, but as a social process. And I think in any improvement work that you do, we are talking about an inherently human and humane endeavor. So it's a social process. And the hashtag 2035 effort certainly is a social process. And that means that working with, alongside, and with people is going to be really important. In my work, I am very privileged and I feel very grateful every day that I get to work with people like you and others across the world to improve things. So I'm always in community, always within a social process, and always with an ethos of learning. So those are some introductory comments before I ask you a question. And I thought I could see the chat as I shared my screen, but I can't. So I'm going to just ask you the answer to this, and I'll kind of look at the chat in a second. But what's the answer to this equation? And if you want to just type it quickly in the chat, there's only one answer, so no problem. If you haven't had advanced maths, this is a pretty simple one. And then I'm going to ask you to type in there the value of x and the value of y on this equation. And the ones who have been with me before may have seen it in our interaction. But so first, 5 plus 3, and secondly, the value of x and the value of y in this equation. And remember, 5 plus 3, type 1, 5, x plus y equals 13, type 2. So I'm going to close this and just take a look at the chat briefly and then ask you a question. Remember, type 1 problems, type 2 problems. Yeah. So the big question for you guys is whether you live in type 1 land when you do your daily work, where there's a perfect formula and there's only one answer, which is kind of perfect and non-disputable, or type 2 land where you know the answer, you're trying to improve healthcare or trying to improve health and there are some elements to that equation, but you're not really sure of the value of those elements. That's what you're trying to figure out. So if anybody lives primarily on type 1 problem land, can you put your name? Can you say me on the chat, which is 5 plus 3 equals 8? And if anybody, okay, so there's no takers. If anybody lives in type 2 land, can you say me on the chat just to get a sense? Yeah, so Serena, type 2 woman, and I suspect that for the people on this call who are working on complex problems, you definitely are on type 2 land, right? And the reason why the remarks around continuous improvement might be useful is because we live in type 2 land, the majority of the time as we try to do our improvement work. And that requires going beyond the traditional kind of quality control and quality assurance mindset, which is, we set some rules, we tell people to do it, we bring somebody to look at whether they're doing it, and that's it. We're doing our work of improving what we're trying to do. And that's not nearly enough. So the invitation on this conversation is to go towards a continuous improvement way of doing things. And I'm going to give you some thoughts around the method to do that. And I'm doing that also because I'm a firm believer. This is my nephew, Alejandro, Ale, as I call him. And I'm a firm believer that we are born improvers. We are born improvers. When you come out of your when you came out of your mommy's tummy, the first thing you tried to do was probably to seek to be nourished, to be breastfed. And you didn't just latch onto your mother's breast immediately. You went for it. It might have been sore for her. It might have been odd for you. Then you tried again, and then you tried again, and then you tried again until you achieved something that resembled you consuming the lovely milk and being able to be nourished. And then over time, you probably adjusted your way, and your mommy probably adjusted her way to allow you to be nourished. And as we learn to walk, we first go on our backs, then on our fronts, then we crawl, then we grab onto that sofa and kind of walk sideways. Then we start to walk and fall a few times, and then we eventually learn to walk and to jog and to run and so on. But this is an inherently human thing that we do. We are improvers. So when my nephew Alejandro was learning to eat his first mango, he didn't have it all figured out. He had to try once, and then as he was enjoying it so much, he tried to grab it again, and eventually went for it again, and he failed, and then humorously he tried to grab it again. So we are natural improvers in doing our work. This is Alejandro 5 years later. This was last week, as he kind of visited a little farm where there were fish and so on. But we are natural improvers. And as I talk about these methods, there's nothing kind of overly technical. There's something systematic, but not overly technical. Believe me, you are an improver already. What is true, though, is that the system that you live in, whether that's your personal life, my system in terms of how I do my daily living, or my system in terms of the way I run my relationships, or the systems that we work in, there is this fundamental truth, which is that our systems are designed to get us the outcomes that we get. There's a black and white statement. Every system is perfectly designed to get the results that it gets. So what that does is it puts the onus on us to redesign our systems and to continuously learn in order to continuously improve in service of what we're trying to achieve. And in our personal life is often having a good life. In our work scenarios, it depends on what you do. For people that work clinically, to improve the outcomes of and the experience of people who come to be served by them. People that work in communities is to improve the well-being of populations and so on. But this is a fundamental truth behind continuous improvement. So 3 things as I kind of share with you a little bit of reflection. One, let's go beyond this idea of empowering people. That means that we hold the power and we're ceding it or something like that. This is about partnering. So as you work with your communities, they're partners. We're horizontally related, and we need to co-design, we need to co-produce, we need to partner. And in order to partner, we need to understand that sometimes in human relationships there's tensions, that sometimes there's historical hierarchies that we have to acknowledge, and that we are going to need a lot of humility and a lot of ability to listen. So partner, it's the very first thing. When we went to Chile to work in schools, in preschools with children, after there had been a randomized controlled trial of some interventions connected to obesity in schools, to chronic absenteeism, so kids missing 1 out of every 5 days of school, of classroom environment. The very first thing that we did was to get the Ministry of Education and the local representatives did the quality assurance of schools to move out of a highly hierarchical way of thinking, which was, let's put some posters on the walls and let's make sure that when we come to regulate, we see what people are doing, to asking what I call the magic question, which is, what do you think? Asking kids what they thought. These were preschool kids, 3, 4, and 5-year-olds, and asking teachers who live in the system what they thought. So you're honoring their wisdom. And when we asked them what they thought about the reasons why they were drinking juices and Coca-Cola rather than water in this deprived area schools, they said, look, the first thing that comes to mind is that we don't have any running water and we don't have any clean water. So can you make this available to us? So the intervention was a lot simpler than what we originally thought. It was to put a jug of water, some cups so that they each had one, and then to engage them in the measurement. So they could put a little bead when they drank a glass of water and a little bead on the left when they drank a sugary drink. So you're partnering with those who are the protagonists of the system, who are those that live in the system. In your case, for hashtag 2035, is those that live in the communities that you serve. We also wanted to make sure that we made the learning relevant to them. So we asked them every day in these classrooms that were participating, the plant on the left, they had to water it, the plant in the middle, do nothing with, and the plant on the right, throw some Coca-Cola on it every day. And in this way, these kids were seeing the impact that water versus sugary drinks had in their bodies. When we looked at chronic absenteeism with them, we had them come into the classroom every day and put a little red square on top of their name, so that over time they could compare their attendance to their friends. And at the end of the month, we had a celebration event where people were rewarded and honored if they were the best attenders and their absenteeism was the lowest. All these experiences are reflected in this book, Un Buen Comienzo para los Niños de Chile, a good starting life for kids in Chile. And it's a lovely continuous improvement effort. We measured what we did. Kids and teachers tested solutions based on evidence, and then they improved the system. I'm delighted to say that 12 years later, we started this in 2011, 2012. The network of Un Buen Comienzo is still going and it's still live, and it's been institutionalized, and there's very close connections with the Ministry of Health and Education and so on. And it's in over 200 schools. So a lovely example. And, we didn't know this at the time, but when we looked at what the psychology of change was teaching industry beyond healthcare, we looked at healthcare, but we also called people like Starbucks at the time and so on. We discovered that at the center of change was this idea of our agency, our ability to make a difference and act. And the whole ethos of change was to activate what people already brought, which is their agency. And these were the 5 drivers. I won't belabor this, but as you hear me reflect, you probably see this reflected on every example that I bring. Intrinsic motivation and how to unleash it. So asking people what matters to them and understanding what drives them, and then building on that, co-designing and co-producing, making sure that power isn't held, let's say, centrally or by 1 or 2 people, but rather distributed. And then this idea of Alejandro and his mango, testing. So you adapt in action, you test, you learn, you test, you learn, you test, you learn, you measure, and so on. There's also a very strong reason to partner, and it's the fact that we have a fantasy view of organizations, which tends to be the organizational diagram, which has boxes and arrows and linkages and so on. And that's important. That's system 1. So the strategy and the governance framework and the formal position. But there's also a system 2, which are the dynamic networks of activity led by people. And when you talk about hashtag 25, obviously system 2 is where people live, the daily life that they run. So as we do improvement work, as you're seeking to close that life expectancy differential, it's important that we understand our organizations as having system 1 and system 2 realities, and considering those is really hugely important. So partner. The second invitation is to use a method and to measure something. To make sure that you're learning from what you're measuring. And I'll show a couple of things here, in terms of the method. So firstly, as we do intuitively, understanding first where the gap is, and then what our system looks like. Remember, every system is perfectly designed to get the results that it gets. And then once we have that clear and we use tools to understand our processes and our systems and our data, we use a way of framing what's possible. In our case, we love to use this model for improvement, which has three questions. One is aims. What are we trying to accomplish? So it's not enough to say we're going to close the life expectancy differential. We like aims that have a how much and by when and for whom. Life expectancy differential of whom, by how much and by when. So what are we trying to accomplish? Secondly, that we have things that we measure and we learn. So how will we know that a change is an improvement? We know all improvement requires change, but not all change leads to improvement. How will we know that a change is an improvement? That's about learning. And thirdly, it's the question that is the partnership question. So what changes can we make that will result in improvement? We take what's evidence from the journals and the randomized controlled trials and so on, and what is the local wisdom of experience, and we combine those. And we interact very closely with those who live daily in the system, and we ask that question, what changes can we make? And then we build our theories on that, and we build them to test them. And then we plan, do, and study and act. So we plan our changes, we do them, we study what happened, and then we act as a consequence. And as we progress towards our aim, we work towards learning, but also towards scale intentionally. So this is in essence and in an overly simplified way, what I call a method. You may have millions of methods. This is one for continuous improvement that has really served us well in health and in healthcare across the world. As I talk about understanding the problem, you know this stuff, brainstorming, root cause analysis like 5 whys and so on. And then tools like cause and effect diagrams, where we sit down with the protagonist of the system and say, hey, what is the effect? What is the gap that we're seeing? And then how are we understanding what's leading to that outcome? So cause and effect diagrams are really helpful. And then Pareto charting, as we worked to close medication gaps across 42 integrated care systems across England, it was probably not useful to work in every one of them in depth. When we looked at the data, there were 10 out of the 42 that were responsible for the majority of the prescribing. Well, you focus your effort on that, and from those 10, there were 2 to 5 that were probably responsible for a high proportion of the prescription. So as you look at your system and your understanding, and you look at your data, then you can refine your aim and move more intentionally and in a targeted way to where you're going. So I introduce you to Alejandro, Ale, my nephew. This is my niece, Emilia. And Emmy, we got the news a couple of years ago that Emmy has leukemia, chronic myeloid leukemia. And it's an unfortunate diagnosis that comes to many kids around the world. And in a way, we're lucky here in the UK because our outcomes are outstanding. 84% of our kids have a chance of being alive in 5 years. That's not the case in low and middle income countries. Emmy, my niece, lives in Venezuela. And as it happens, when I got the news, we had already been working with a global group called St. Jude's Global, who are absolutely wonderful on this effort called Colaborativa Más, or the Golden Hour. And what we were trying to do was to close this 5-year survival rate. And I'm using this as an illustration of using the model that I just showed you in practice. So we knew there was a gap of survival, that a much lower proportion of these kids survived, despite us knowing the science and so on. And we knew that a lot of these deaths were preventable. So we started with purpose and by kind of understanding the communities that we were serving and so on, and reviewing the evidence. This is Alejandro, who's not my nephew, by the way. He just happens to be of the same name. And we started by asking families and the kids, what they wanted to be when they grew up, because we knew that would be a driver for clinical and community teams that were working in this effort. This effort started with 23 institutions in one country, and now we're working with 85 across 6 countries. And there are many people here. So as I speak, you hear all of their voices in here in these 6 countries. So we knew that we had to focus somewhere. It wasn't enough to say we want to reduce mortality. Where do we start? So we started with infections, because we knew that a child that has their immune system compromised is less likely to survive after an infection. So we started there and specifically started with making sure that kids that had a fever that came to a hospital got an antibiotic within 60 minutes. And those 60 minutes is what's called the golden hour. We asked teams for the magic question, which is, what do you think? They started to describe what their system looked like initially in the 23 hospitals and then in the 85. And combining both the evidence of the stuff that was published around the golden hour and the help of two of the hospitals that were participating in understanding their system using a cause and effect diagram, mapping their processes and so on, we understood the starting point. And the starting point is here. You see a process map. So from the time a patient arrives into an emergency department until they get the antibiotic. And you understand that for many hospitals, it took more than twice the amount of time that it should have, and that increased the risk of death for kids, which was clear. And for some hospitals, this was a lot worse. So once they owned the diagnostic of where they were, it was much easier for them to figure out some of the answers. So we use this data to frame an aim. Remember how much, by when, and for whom. This is the aim of the collaborative, how much improvement, by what time, by December, by November, by May 23, and for whom, for children who have fever, who show up to emergency department. So the case of hashtag 2035, you'll probably consider aims that have time boundaries, that are very community centered, and where you can describe what improvement you want to achieve. And then we created a learning community around this, which we call a breakthrough series model, where the different institutions were coming together a couple of times a year in person, and then they were receiving coaching and learning from each other monthly. We created a measure. So remember the model for improvement. The first thing is the aim. I just described the aim. Secondly is how will we know that a change is an improvement? This is what we call a family of measures that has some outcome measures, some process measures. And then we put the theory of change into the form of a driver diagram, which has an aim, some primary drivers, some secondary drivers, and as importantly, the things that people test, which are the change ideas. I won't belabor the driver diagram because we're not here to learn about how to reduce kind of the chances of children with cancer dying, but this is what the driver diagram looks like in our effort. The aim is on the left and it's very well articulated. So the 5 primary drivers based on the published evidence and the experiential intelligence from teams. And then there were some secondary drivers and some changes that we encourage teams to test. Just to kind of go deeper, each of these primary drivers had a change package where some of these changes were described more in detail. And then people test the changes and they discover things like this, that supplies were distributed everywhere and it was hard to get them. And that was one of the causes for delay. So they created this little golden card or El Doradito, as they called it. One hospital did this and then many hospitals copied it because they were working collaboratively in order to close the gap. Like this, there were many, many changes across the learning system. And I just want to go straight to the results. It wasn't linear, it wasn't easy, but there were some really concrete results. And because I'm describing the opportunity to use a method and measure something, I want to show you what this looks like. So the results are like this. There was a 60% increase in terms of the number of kids coming through and getting their antibiotic within an hour. And there was a 60% decrease in terms of the number of kids acquiring sepsis, which would eventually have a much higher risk of death. This was based on 6,500 kids, and it meant 347 sepsis cases avoided, 29 deaths avoided, 99 kids not having to go to ICU, and 5,500 days of ICU beds saved. So we are kind of clearly measuring to learn, and every month these hospitals took their measures, met locally, and learned together. As we think about this, and if you're slightly nervous about the continuous improvement movement imposing things on people, I just want to introduce you to Luca. Luca is my friend Walter's kid. Walter lives in the Amalfi Coast. His family own a little place there, and they make what I think is the best tiramisu in the world. And in making tiramisu, you have some core ingredients. I asked him to teach me how to make it, and he brought me into the kitchen, and I had a little notebook, and I tried to write the amounts of tiramisu, and Walter was just pouring flour and cream and cinnamon and coffee and so on in strange amounts, but the ingredients were core. So he was saying, "Oh, Pedro, don't worry about the amounts." So I was trying very studiously to write the amounts, and eventually we landed in some rough amounts. But if you go to an Italian restaurant near you, the tiramisu will probably be slightly different flavor, and they would use probably slightly different amounts, but it's a tiramisu. So the core ingredients are the same. So as you think about improvement, and as you move from understanding the process to using the model for improvement to then scaling, the scaling has a lot of tiramisu in it, which is teams adopt locally and adapt locally based on the evidence and their experience and the changes that have been agreed, let's say, by the community, but they adapt to make sure they make their own tiramisu. So, as I talk about this and the method, what's behind it is what we call improvement science, which considers the psychology of change that we talked about, the systemic connections, the way that we test and learn the theory of knowledge, and then we use data over time to understand variation. When we've been working with 7 accelerators on this agenda in England, the Core 20+5 agenda, 20% poorest populations, and the plus populations are other minority or excluded populations on 5 clinical areas. And I wanted to show you this to ensure that we were clear on the specificity of the aim. So if you look at early cancer diagnosis number 4, we started with these teams and invited them to go inch wide, mile deep. So it wasn't for every cancer at the same time everywhere, but it was for specific cancers and specific populations that were being left behind, part of Core 20+. Okay, so as you think about your aims, think about the population, a very specific population that you're serving and what you're trying to close. And just to give you one example of how it translates, this is the Lancashire team. So improve early cancer detection and early stage diagnosis within the specific population. So bowel colorectal cancer, Southeast Asian women and men in the St. Matthews area for over 55. So you're not talking about every cancer, but you're talking about a very specific population. And what that allows you to do is to go inch wide, mile deep in terms of what you're trying, the gap that you're trying to close. So first message, partner. Second, use a method and measure something. And the third one is this, put learning on steroids. I think this is so important. So how you use that data and how you connect with teams to reflect. So how are you learning about the learning? So are you meeting every week and having a huddle? Is that your ritual? Are you using symbols? Are you bringing data? Are you bringing pictures? Are you bringing stories? And how much space are you putting into this? How urgent does it feel to people? How possible does it feel to them also, given all the other demands of their lives? So when I talk about learning on steroids, and as you heard me tell a few stories, this is hugely important, how you use your data and how you reflect on the tests of change that people are doing in order to learn to continue to make progress. And you could have daily huddles, you could have weekly huddles, you could have monthly meetings. It's important that you have rituals and that you have symbols. So the pictures, the data charts, or the stories that you bring that convey a sense of progress and learning. And I'm going to share one quick story here, which is about learning, not just from what's going well, but from failure. As I gathered with fellows on population health equity in Lancashire and South Cumbria, I was invited to one of the rituals as I was doing my conversation with them, and it was a bonfire of failure. This was GPs, about 25, that had been working on closing equity gaps for a year. And when I met them, and when we talked about continuous improvement, it was their closing session. And we did this, which is gorgeous, a bonfire of failures. So each of them wrote a failure as they were trying to improve on a piece of paper, and then they threw it in this little basket. It burned, and then as the sparks were coming out, they reflected on how they were using that learning to improve themselves or improve their systems. So as you put learning on steroids, consider how you're planning to learn, not just from successes, but also from failure. As I kind of close my remarks, I want to tell you that you have many peer communities working on things. This is the Young Shipping County family working on for a good life program. These are municipality and healthcare leaders together. We've been working with them for the last 18 months, and they're doing a beautiful job of trying to improve population health. And if you want to reflect on some of the things that I've shared with you and that you have accumulated, we wrote a little paper with some friends from the UK, Sweden, Denmark, and so on, around improving population health, where you'll see some of my reflections today reflect. So truly partner with your communities and with your community partners in order to get to and move forward with hashtag 2035. Use a method. I chose continuous improvement, of course, and measure something to learn. And then put learning on steroids. Create your rituals, use your symbols, and keep the pace on what you're doing. As I close, and some of the Westminster people are in this picture, actually, which is kind of beautiful. We were in Pärnu in Estonia. And when we asked leaders from our Health Improvement Alliance Europe to reflect with us what key characteristics they thought leaders should consider to have into the future, a word that kept coming up often was curiosity. So together with the Improvement Alliance members, we curated this list of 5 simple rules. And as you do your hashtag 25 work, I think these are hugely important. Curiosity means asking rather than telling. So going into conversations with an ethos of asking rather than telling. Secondly, listening to understand rather than to respond. So, being very humble in your inquire, listening to understand rather than to respond. Making sure that we make room for every voice rather than those easiest to hear. And you can kind of probably recall many conversations where there's been a couple of voices that always speak. Make sure you make room for every voice. Fourthly, prioritizing not just problem solving, but primarily problem framing so that you can get to better solutions. And this last one, I think it's important, and it's something that we've all inherited from our schooling approach, which is vulnerability. Treating vulnerability as a strength rather than a weakness. We've always been told that we need to be strong, that we need to have all the answers, that we need to be right or wrong. Treat vulnerability as a strength. Hey, I don't have all the answers, but I know that we can figure it out together, and so on. So bring curiosity into your work. Invite the people who are closest to the work, closest to the living experience of receiving services, to be protagonists. In the case of Fernando, he partnered up with Juan to discover the first well in the farm. I also met Juan, who's a wonderful guy. So as you seek to find the well, so the method or the secret sauce to improving your community, make sure that you partner closely. And then lastly, this is something that we all need to do together, So this is Mexico. They're weaving together these massive pieces that are providing shelter. As you do your work, remember that we're weaving this thing together for a better social climate, for a warmer set of behaviors out there, and of course, to close the life expectancy differential across Westminster. But congrats on the work that you're doing. My email address is here. I'd love to stay connected, and I think I'll pause because I've used my 30 minutes or so, and we can have a quick conversation, I think.
Thank you so much, Pedro. So what I'm going to do now is I am going to unmute everyone's mics. So if you have any questions or comments, this is your opportunity to share. So yeah, everyone, your mics are unmuted, and you can also turn your cameras on if you want to. Does anyone have anything to share or add, or questions, remarks? Go ahead, Serena.
Thanks, Priscilla. Pedro, wow. I mean, I could just listen to you days after days after days after days, because I think you provoke us always in a really kind way. And I suppose my kind of one, maybe it's a question out to the room. Like, I know that there's some colleagues that we're directly working with from Imperial and stuff on the call. but it's kind of like your point around, we know we need to go inch wide and mile deep.
Mhm.
And recently, I think for hashtag 2035, whilst we're really, really focused on those wider determinants of health, and that we really need to come together as local authorities who have, kind of most of the responsibility around those things, but also to kind of come together to look at those health interventions that we can take, kind of like in the short term or medium term. And I suppose we've done maybe the inch bit. Like we've got, I think, maybe four kind of particular health conditions that we know we want to really kind of focus in on in the short term. But that kind of mile deep, can you just maybe just speak a bit more about, I know it's about kind of going more detailed, but for me there's this kind of connecting in with, what are those health conditions? What do they mean for the communities that we most need to serve? And I don't know if you wanted to just kind of speak into that, or indeed if any of our colleagues from like Imperial just kind of had any reflections on that part. But thank you so much, Pedro. Sorry, that was a long question, Priscilla, as usual,
Serena, I'll make a quick reflection, but I'm keen to hear if others have some as well. Going mile deep means truly getting to know your communities and truly designing with their wisdom in mind. It wasn't until the Lancashire team that I showed before for South Asian men and women focused both on colorectal cancer, on St. Matthew's as a neighborhood, and on male and females that were over 65, that they were able to bring them together. So they created a space for them to have a focus group. And I tell you, when I heard what they learned from that conversation, it was more valuable than anything they had done in the 6 months prior. So when I say mile deep, it's that, because then you can design truly to speak to those communities, as opposed to assuming, look, maybe it's just me, but I think we sometimes are pretentious. We have jobs, we have salaries, we have some knowledge and some education, and sometimes we think we have the answers and we know better. But it isn't until we hear and we really go mile deep that we understand how we need to design with humility in mind in order to address those access issues or those kind of concerns that people truly have, as opposed to assuming that we know. So that's what I mean about going mile deep. We're using the methods to really listening, understanding, and then using that input to design and craft things that both resonate with the communities that we're serving and speak to their realities.
Brilliant. Thanks, Pedro. I'm not sure if any. Yeah, just not sure if any other
Sorry.
colleagues want to. Sorry.
Yeah, did anyone else want to add? I'm just going to read some comments from the chat. So it says, from Fahida, it says, such a moving presentation, feeling ignited to keep going with the project I'm involved in. Thank you. Bola says, complete masterclass with the anecdotes were amazing, simply to get. Thank you. Also, Pedro, someone's in the chat has requested for the slides. So if that's okay, if you can send me the slides, and I'll able to disseminate it to the rest of the attendees. Just before we wrap up, does anyone else have any questions or comments that they want to add?
Priscilla, can I use, and Serena, I want to, of course, my ethos is always to be encouraging, and I think this work is brilliant, the hashtag 2035 stuff. I think we have a challenge and an opportunity. The challenge is the challenge of tangible impact. So making sure that we move beyond, as I know you do every day, the rhetoric of the equity gap and the people being left behind and so on, which is so important because there's real suffering there. To that being connected to the hope of, look at these outcomes and look at what we're learning and look at these stories and look at these cases. So as you do this work and move forward, kind of think about that challenge and opportunity that you have, because I think it's an opportunity, and the opportunity comes with all the benefits that this brings, which is you can share it with other communities that are trying to do very similar things. As I travel across the world, I see many geographies that are trying to do exactly what you're doing. And I think you are in many ways ahead, because you have a memorable label, 2035, so you know the length of time. You have a relatively well-defined big aim, which is the life expectancy differential, cutting it in half. And then, the challenge, of course, of Serena doing the inch wide, mile deep underneath that, so that you can truly get to those communities to make the measurable impact that you want to make. But take this opportunity with both hands and kind of run with it. It's so unique and it's so relevant.
Thank you. Sorry, Priscilla, I'll just come back in. I mean, I know this feels like the Pedro and Serena show, but like, why change the habit of a lifetime, right? Let's just do it, right? So, Pedro, like what we would be incredibly kind of privileged, and I know through my kind of being part of the IHI, like just brilliant being able to connect with people internationally and kind of, speak hashtag 2035, but also kind of understand from them. But Pedro, if there's any other, and I know you always do connect me like on LinkedIn and stuff, but if there's any other areas really kind of driving and really implementing in word and deed that inch wide, mile deep work, please do kind of connect us so that we can learn. Like we're on that learning journey. I don't think we'll ever come off, but like, yeah, we wanna be as impactful as we can, because this is literally life and death, right? So yeah, but thank you so much.
I will do, Serena. That's a promise, a public promise here in the room.
Robin, did you have a question or a comment to make?
No, I didn't. Just thank you so much. I'm coming at this from a bit of a different lens. I'm a Westminster resident, but also work in the ICB, so interesting to see a bit of what's going on.
Great, thanks for joining us today.